Gut and Psychology Syndrome. This is the book that you got today. That's where I describe the situation. Gut and Psychology Syndrome, I describe the brain. What happens in these patients? The blood-brain barrier is damaged in these children and adults. Because the blood-brain barrier is made out of cells which are brothers and sisters of those parasites in your digestive system. They're similar, they're epithelial cells. And they also have tight junctions between them, glue. They're glued together. And those toxins that dissolve the glue in the digestive system, when they get into the blood and reach the blood-brain barrier, they do the same thing here. They dissolve the glue. And they open up the blood-brain barrier. So all these toxins and microbes and autoimmune cells, autoimmune attack, get into the brain and attack the brain. And depending on what kind of mixture of toxins coming in, how many toxins, constitution of the person, what kind of immune attack is going on, the brain will produce a group of symptoms. And in some situations, psychiatrists can put these symptoms into a diagnostic box and give it a name. Call it schizophrenia, or call it autism, or call it something else. But in the majority of people, psychiatrists can't do that because every human being is unique. Every human being has a unique gut flora and a unique brain, and they will develop a unique group of symptoms. That is what's happening to 80% of children who have this problem. They have a little bit of autism, and a little bit of ADHD, and a bit of dyslexia, and a bit of dyspraxia, and a bit of this, and a bit of that, and none of it fits into any diagnostic box. So with these children, pediatricians procrastinate. They tell the parents, bring him for observation 6 months later, and then again 6 months later, and then again 6 months later, until the diagnosis is given to the child. And a precious time is being wasted when the child could have been helped. Because the younger the child is when we start the GAPS nutritional protocol, the quicker they recover and the more fully they recover. The longer the child has been in this state, when the brain is bombarded by toxins, the more damage is done to the brain, the more development the child missed out, the more difficult it is for the child to recover. And the longer it takes, and less fully they recover. That is why I tell parents, and please tell everybody you know who has children with digestive symptoms, digestive problems, any kind of digestive problem, don't wait for diagnosis. Don't wait for mental symptoms to develop. Start the program now. Fix the digestive system now. If we take a 2 or 3-year-old child and put them on my protocol, 6 months later they're developing. It's all fixed, they're okay. They're doing well, these children. So what happens? What kind of GAPS conditions are we talking about when these toxins are flooding the brain of the child? The most common and the most severe is autism. And that is a terrible, terrible, tragic situation. Vast majority, more than 99% of autistic children are born with a perfectly normal brain. These are normal children when they're born. But the child acquires abnormal flora from the mother from day 1. And in the first 2 years of life, this river of toxins starts flowing from the gut to the brain, and it clogs the brain with toxicity. These children are basically get poisoned by their own gut flora. How do babies learn? We all have children. How do they learn? They listen to everything. They look at everybody. They touch everything. They take everything into their mouth. What are they doing? They're using their sensory organs, their hearing, their vision, their tactile sensitivity, their taste buds. They're using these organs to collect information from the environment. And then they pass this information to the brain. The brain processes this information, and from this information the baby learns. Baby learns that this is mommy, and this is daddy, I can trust them. This is a toy, I play with this toy like this. This is food, I eat it like this. These are other children around me, I copy them, I play like them, I do what they do. But if the child's brain is clogged with toxins, the brain can't process this information properly. This information turns into a noise, into a mush, into a porridge in their head. And from that noise, the child can't learn anything useful. Autistic children are known to pick up a hand of any stranger on the street and walk away, with mommy running behind and screaming his name. Because mommy doesn't mean any more than any other stranger around, any other human being. They don't know what you do with toys, they don't know what you do with food, they don't know what you do with other children around. They're in a fog, in a toxic fog, these children. That is why they're not learning. And the longer this fog continues, the longer the child is trapped in that toxic fog, the more damage, physical damage, is done to the brain itself, to the structure of the brain, to the anatomy of the brain. When we do PET scans with 3-year-old autistic children, we see a perfectly normal brain. When we do the same scan with a 23-year-old autistic person, we see a damaged brain. We see areas of the brain which have been destroyed, damaged, there's atrophy going on there. Because this bombardment of toxins and autoimmunity and microbes, month after month, year after year, then damages the brain, the integrity of it. And of course it is far more difficult to help a person like that than a little child whose brain is fresh and normal yet, to stop that river of toxicity coming into it. If the level of toxin is different and the toxins are different, then the child may not become autistic, but will become hyperactive, develop attention deficit hyperactivity disorder, or attention deficit without hyperactivity, or the child may become dyslexic or dyspraxic, or the child usually doesn't fit into any diagnostic box because they have individual unique symptoms. When the brain accumulates enough toxins to start actually damaging its physical structure, in a proportion of these children, the brain develops a safety valve, a cleansing survival procedure. It sends one electric discharge through and cleanses the whole lot of toxins out, kills all the parasites, cleans out toxins, cleans itself up. And that is an epileptic seizure. Epilepsy is a survival procedure of the brain. And at the more severe end of the spectrum of learning disabilities in children, we have almost 80% of children having these seizures because they have more toxins. At the milder end of the spectrum, we have less epilepsy, about 10% of children may develop this survival procedure. The last thing these children need is another toxin added to the equation in the form of anti-epileptic medication. We need to remove toxins. That is why the first thing that medicine should do is put them on the GAPS nutritional protocol, put them on the diet, to heal and seal the gut wall, to change the gut flora, to remove pathogens from the gut. Then this river of toxins will stop, and the brain will clean itself up. The brain has a beautiful ability to clean itself. It cleans itself all the time. And it renews itself all the time. Just like in the digestive system, those little enterocytes are being born all the time, the same happens in the brain. Majority of brain cells live a short life, they die, and they're replaced by baby cells, by newly born baby cells. So the brain has a good ability to renew itself, to recover and to clean itself up. All we have to do is stop that river of toxins coming to it, and then the child starts developing, and the child starts recovering. And the same happens with the adults. When these children grow up, unless we treat them appropriately, they become GAPS adults.